Again, elimination diet is going to be helpful because there'll be some people that may be sensitive to eggs, maybe sensitive to nuts or seeds. And so you want to look deeper because these foods are healthy. Like if you're following a paleo diet and you're eating eggs and nuts and seeds, you may think, I'm on it, I'm doing a great job. And you probably are. But that's why it's great to do an autoimmune elimination diet as well. Now, some people may even be more sensitive, and that's where the FODMAPs, going low FODMAP, or even going carnivore can be helpful because carnivore is the ultimate autoimmune and low FODMAP diet. It's cutting out all the potential carbohydrate fermentables, right? FODMAPs are fructo, oligo, disaccharide, mono, and polyols. And those foods are going to be in probiotics, which are good, but they're also going to be in onions and garlic and broccolis, and they can feed, essentially be a primary fuel source for a lot of that dysbiotic bacteria. So pulling that out can be helpful. Cooking the foods down and a lot of the fibers down can also be helpful. Carnivore is the ultimate because some people I've seen are really sensitive to even healthy vegetables that are low FODMAP, just maybe the anti-nutrient load in those vegetables. Maybe it's the salicylates, maybe it's the phenols, maybe it's some other anti-nutrient in there, can be too much for some people. And so going full carnivore for some may make sense. For most, I try to do an autoimmune lower FODMAP because you can at least get some carbohydrates. You can at least get some micronutrients in the vegetables. You can get potassium. You can get magnesium minerals from that. You can at least get maybe some safe starchy carbs, whether it's from carrots, whether it's from squash, parsnips, turnips, rutabaga. Those are some good options. So outside of that, so I hope I kind of laid some things out. When you look at leaky gut, obviously taking a medication for it would not fix the underlying issue because the protein zonulin is going up due to an inflammatory response upstream. So you cannot remove the downstream effect without removing the upstream cause. So just kind of keep that in the back of your head. We did it with Vioxx. We did it with all kinds of other drugs, and we have side effects. 1 out of 3 drugs the FDA approves ends up getting pulled from the market a few years later, right? So even all this phase 1, phase 2, phase 3, 8 years of study, 1 out of 3 drugs gets pulled after the fact. Okay, look that up. Very important. So think about the underlying root causes here. Root cause number 1, make sure, what is leaky gut? Zonulin goes up, gut permeability goes up. Tight junctions are a protein. This protein it keeps those enterocytes intact. When we increase zonulin due to the many different factors that we've talked about, whether it's gluten, whether it's not having enough good amino acids and nutritional support, glutamine, glycine, proline, good nutrition, good nutrients to help with oxygenation, mitochondria, iron, especially if you're anemic or celiac, right? That's a big common factor. Low B12, that's going to impact it. If we are getting inadequate levels of probiotics, if we have a lot of dysbiosis, our probiotic levels are low. Lactobacillus, bifidobacter, the different subspecies. If we have a lot more dysbiotic bacteria, Klebsiella, Citrobacter, Pseudomonas, Morganella, Prevotella, these dysbiotic bacteria are going to increase endotoxin. They're also going to produce histamine. So then now you're more inflamed. You have all this endotoxic load on your liver. And then now you're overproducing histamine. So now you may be more sensitive to citrus, bacon. Maybe you're starting to have wheals or urticaria or hives or brain fog. So it's important to get the gut bacterial imbalances knocked down.